And um, as you'll see, that comes from both doing interviews with survivors themselves, as well as more quantitative data, survey-based data. Next slide, please. We also want to send a huge thank you to our funders of the RISE work, so the Administration for Community Living. Uh, you know, we really could not have done any of this without you, as well as the Public Health Agency of Canada. So thank you very much. Also want to recognize our larger RISE collaborative team. Many of you would know these people, and the really kind of special thing about our team is that we do come from very different disciplines, different perspectives, different kind of areas of expertise, whether it's research or kind of practice or operations or policy, and sort of different disciplines as well. And I think that's been really, really helpful. Next slide, please. It was a population-based study that used a fairly large random sample of older adults, and we asked them questions about elder abuse. And one of the things that we asked, after we kind of asked them a few questions about whether they were experienced specific mistreatment behaviors that kind of made up these different mistreatment types. There was a follow-up question that then asked them, well, okay, so they've said yes to a certain mistreatment behavior, which is, from a validated tool, the conflict tactics scale, and as researchers and professionals, most of us kind of thought that if you answer yes to this question, then for sure that's a problem, and we're looking at a victim of elder abuse, and but we've then asked this follow-up question, basically from your perspective, from the older adult's perspective, how serious a problem do you feel this is for you? Next slide, please. And then when we tried to look at the factors that sort of predicted whether or not somebody appraised their situation as not serious or serious, these were some of the findings, and some of the more consistent findings was the nature of the relationship between themselves and their harmer. Specifically, if it was a more sort of a closer offspring-related relationship, so if the harmer was a child or a grandchild, they were significantly less likely to see the situation as serious. In other words, if it was like a paid caregiver, for example, they were more likely to see it as serious. And so again, and then another kind of finding that is sort of whether or not they live together. If they were living together, they were significantly less likely to see the situation as serious. And I think this really starts to bring kind of forward some of the complexities of the cases that we work with. We're working with really complicated family relationships a lot of the time. A lot of challenges in this work is just engaging people into formal support services. This is often a reluctant client population, not an eager client population to receive services. So we were asking them, like, what are the barriers to engagement? And what are the most distressing aspects of victimization? If we know this kind of information, then it helps inform how we design an intervention. And you can see here that we're dealing with some really sort of powerful and kind of profound psycho-emotional challenges. Older adult victims are dealing with feelings of shame, with guilt, self-blame. I raised this child. I blame myself for the way they're behaving. There was a very common theme of concern for others, for the harmer, that I want them to get help. And so, and often putting the needs of the family in front of their own needs. So we realized, and next click, please, that if we're going to design something, it has to go beyond sort of arm's length case management.
And share some case examples. So what is RISE? RISE is an intervention designed specifically for older adults experiencing abuse, neglect, self-neglect, and exploitation. It's a direct service program led by a team of specially trained advocates. And as David said, while it may look like case management on the surface, there are key differences. Unlike traditional case management, RISE advocates are not focused on service coordination, eligibility, or discharge planning. Case managers play a vital role in helping clients access services and navigate complex systems. RISE complements that work by offering sustained relational support rooted in trust, autonomy, and client-defined goals, especially when traditional service pathways are limited, have ended, or have not yet been accepted by the client. Advocates build deep, trust-based relationships with clients and stay with clients for as long as needed. A key distinction of the RISE model is that we can also work with individuals who've caused harm in cases where the older adult requests it. Again, speaking to what David referenced. This is not typical in most service models, but it reflects RISE's commitment to relational and restorative approaches, trust-based relationships with older adults navigating abuse, neglect, self-neglect, and exploitation. RISE collaborative team and the Elder Abuse Institute of Maine, which is the organization that I lead. It's now being expanded nationally. It's 2-3 years in Toronto, David. And we're also doing training with other states, and we are in the process of replicating in 3 different states. RISE stands for Repair Harm, Inspire Change, Support Connection, and Empower Choice. The model serves older adults, as we noted, that are experiencing abuse, neglect, and exploitation. And these are often the most complex cases where people don't want traditional services or don't meet strict eligibility criteria or are reluctant to engage due to prior harm. RISE is not a service you can walk into. Every client is referred by APS, and we work with them at their pace for as long as they need. This could be weeks or, in some cases, a year. This isn't crisis response, it's accompaniment. It's showing up again and again. It's being consistent where trust has been broken. It's allowing the relationship to do the work. Emotional abuse from his younger brother, who had recently moved in with him after losing housing. APS referred the case with an urgent request for placement, but Thomas didn't want his brother removed. He wanted him to get help. The RISE advocate began working with Thomas to understand what help looked like to him. At Thomas's request, the advocate reached out to the brother and helped coordinate a structured restorative conversation. With careful planning, ground rules, and support people present, Thomas expressed how the behavior was affecting him, and his brother shared the stress and shame he'd been carrying. Together, they agreed to new house rules, connected the brother to VA support systems, and created a mutual accountability plan. The abuse stopped. Most importantly, the relationship survived, and Thomas remained in control of the process. You don't just do trauma-informed work, as you all know. Alignment, not just qualifications. Our staff come from many different backgrounds. We don't look for MSWs. We don't look for 30 years of work in the field. We don't look for clinical backgrounds. We have staff that have worked in victim services. We have staff that have worked in long-term care settings. We have staff that are new to the field of aging. We have staff that have been around for a long time. And what we look for in the way we ask questions and the way we evaluate alignment with the job, as we say, people have to want to do this work and they have to want to be here. And so we hire for value alignment, not just qualifications. We invest, as I noted before, in reflective supervision, which means that we try many different approaches and we bring multiple people into our supervisory structure. So in our agency, over the last couple of years, we realized that a person's supervisor isn't, that our staff needs something beyond day-to-day supervision. And so we hired a therapist, essentially, who understands the work and understands the importance of person-led approaches. And she runs a monthly meeting with our staff where they can talk about the challenges of this work with a neutral person who doesn't report to our supervisor. They can say things in that safe space, and they receive support and guidance in managing the complexity. These are just not the lessons of RISE. They're the shifts that this summit that you've all been spending your time in the last 2 days is calling for. What we're describing here is a translation of the principles you've been exploring into daily on-the-ground practice. So here's what we've learned through RISE, and I hope this is helpful to you as you go back to your teams. Principles are a living practice, not a checklist. Trauma-informed, person-led work requires reflection and recommitment. It isn't a switch you flip. You have to practice over and over again. Structure matters, so does what happens between structures. So as I noted before, RISE doesn't ask other systems to break their rules. It fills in the gaps between systems so that people can access support on their own terms. As I noted before, sustainability demands investment, not just in funding, but in time, supervision, collaboration, and curiosity. Progress is built from small wins, and this is huge. A return phone call, a client who sets a boundary, a safe moment of connections. These are the building blocks of our work. These aren't just lessons for RISE, they're the very shifts, as I noted before, the summit is calling for. The last I'll say is that system change requires patience. It requires ongoing reflections. It requires conversations that don't begin and end when you turn on and off your Zoom. And it requires a willingness to really understand what's happening for the people that we're working.
Thanks for watching. If this kept you up to speed on Washington, hit subscribe and give it a like. Fresh federal briefings every single day.